Hello everyone, and welcome to our Advanced Care Planning in Conversation webinar series. My name is Greg Parker, and I will be your host today. I'm a palliative care doctor and the Director of Advanced Care Planning Australia. Advanced Care Planning Australia is an Australian government initiative and the national voice for advanced care planning. In today's In Conversation, I will be speaking with Dr. Craig Sinclair, a Senior Research Fellow at the University of New South Wales and affiliated with Neuroscience Research Australia. We'll be talking about contemporary advanced care planning. Craig is very well placed to be here because his background is in psychology and neuroscience, and his current areas of research includes decision-making and cognitive aging, advanced care planning, supported decision-making, and dementia research. But before I introduce Craig, let's take a moment to acknowledge country and do some housekeeping. In the spirit of reconciliation, Advanced Care Planning Australia acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. We also pay our respect to anyone going through sorry business. Okay, let's get into it. So today in conversation, I want to introduce you to Dr. Craig Sinclair, who will be speaking to me about contemporary advanced care planning, including its latest developments and some updates. Welcome, Craig.
Thanks very much, Greg. Great to be with you.
So Craig, I think advanced care planning is evolving and there's been a lot of banter back and forth. I think what I'd really like to understand is some of the basics, talking if you can explain to us what contemporary advanced care planning is and what has been happening in the space.
Sure, thanks. So I think over the last 20 years or so, we've seen the ideas around advanced care planning be introduced in Australia and around the world and start to become more established. And that has initially been about, well, how do we get these conversations started? And for the people who are willing, how do we assist them to potentially document their preferences so that those documents might be a record of those conversations and help us to deliver care concordant with a person's preferences. And that has been important. I think it will remain important. For some people it really gives them a peace of mind knowing that there's somewhere it's clearly known what they would and wouldn't want, something that could speak for them if they were in a critical situation and couldn't be part of that decision making themselves. However, as the field has expanded and we've taken these ideas to more diverse communities and people who are on different care journeys, we've seen that it's not all that simple, and that for some people it doesn't work like that. And I think part of the difficulty is around this idea of the future and making an anticipatory decision for an unknown future. So that might not fit with some people's cultural worldview. It might be difficult for people who have a very uncertain condition prognostically or in their social situation. And for certain conditions, there might be people who are actually anticipating a period of extended decision making in incapacity, where they need to plan not just for medical treatments at a critical care stage, but actually planning for the rest of their life, not just the end of their life. And so I think the recognition of that has led the field to a point where we need to be looking at a more holistic approach to advanced care planning that's built around ongoing discussions and processes that will help patients and people to understand their condition better and to communicate what's important to them both now and in the future. And some of the ways that that's been talked about in the recent literature includes, for example, Rebecca Sidore's approach, which is about building off in the moment decision making. So what do you need right now? And then thinking about, okay, well, what would happen if that treatment wasn't successful? Where would we go then? So it's starting to become a conversation that's not just about a hypothetical future that could be at an unknown time, but linking it to something more concrete and practical. The other development we've seen, I guess, is people reframing what they think the goals of this process are. And Chetna Malhotra in Singapore and others have talked about us really needing to emphasise the process of preparation, so that we're not so much making a decision now for some unknown time in the future, but preparing for a journey which is going to involve a number of decisions, particularly for someone who's on a chronic condition pathway, where there might be, a number of acute events where they need to have decisions made. How are they going to navigate those? How are their substitute decision makers going to come into the picture at different times? So I think those are some of the more contemporary ideas that have been reminding us about what's really important in the advanced care planning process.
Thank you, Craig. And I think for me, it defines those benefits. The way I see it is, it's really that conduit to providing an open conversation about what matters for me in terms of my future healthcare needs, and how that conversation is conducted. I think there's no doubt it improves communication as well, and also strengthens that relationship towards holistic and person-centered care. But I think the other thing is, that I've started realizing is really it's an important pivot point that supports people to all sort of move on to the same page at the pace of the individual who's talking and contemplating advanced care planning, and just gives that opportunity to really consider not only what's important to me, but who's important and who matters in my decision making. And I think we see, especially in terms of that in the moment real-time decision making, that preparatory approach, and it, I would imagine, takes away that real burden of crisis real-time decision making, where you don't have any reference points. And I think for the individual, it would mean at least it allows an opportunity for the clinician and those people involved in supporting decision making for that individual to reflect on their preferences and wishes, that allows that important decisions to be made in the moment. So I'm curious, and I think advanced care planning is not without controversy. Is it achieving what it's intended out to do? Your thoughts?
That's a great question, Greg, and I think where we start on that is getting clear on what we're intending to do. And so if we look back, there have been some really exciting and successful trials and other projects that have suggested this can be really helpful and paradigm shifting for our health system. But while that has created a lot of momentum in the field, we've also got to grapple with this idea of advanced care planning being a very complex intervention. So in the health research space, we talk about complex interventions as those ones where there's a lot of different factors that go into making it successful, and it's very dependent on the context in which it's delivered. So, for example, who's involved and when in a person's journey is this happening? And it can have a range of different outcomes. And in research, we never get the luxury of actually measuring all of those things that we would like to. But that's the interesting part about it, I guess, is that you see different studies where they've focused on different aspects or they've explored it in different contexts. And they haven't all worked as well as some of those really exciting early trials.
Yeah.
And so there is this sense of having to make sense of what is now a quite developed literature and to understand what is working and where do we still need to do more work. I think one thing that has come through from that is that if we're focusing our main efforts on trying to get more advanced care directives documented, that in itself, if it's not supported by structures and ongoing conversations, is not going to change a person's experience or the quality of the care that they receive. But what we are seeing consistently is like you were referring to before, that when we're taking that more in-depth communication-based approach and then seeing its impacts on a person's understanding, their acceptance of their condition, their communication and the clarity that maybe substitute decision makers have about what is their role, there we can see the benefits. And so I think moving towards that communication-based approach and understanding the complexity of that will be the next challenge. As an example of this, my colleagues and I have been working on a project that we call the EARLY project, and that's focused on trying to introduce advanced care planning discussions earlier in a person's trajectory rather than at a crisis time when they're in an acute situation or in a care transition. And we're also trying to take an opportunity there to say, well, what does a person really need in that time, in that sort of conversation to start that process? So we're flipping the traditional approach that has been about building it off the person's existing medical condition and instead starting with where is that person expert, which is around their life story. So we start with some life story work to build rapport and to give a person a place that they can reflect on what's been really important to them across their life and now, and then start to think about what are some activities we could do that will help people express their values for the future, and then put some more structure around that with more specific scenarios that they might then explore about what their preferences would be. And this culminates in supporting them to then have a meeting with a healthcare professional where they can ask questions or express their views that have become clear to them through telling their story. So we're looking at ways that hopefully are innovative and will be enjoyable for people and meaningful. And hopefully we're coming to the end of one trial on this that we'll see some results there around what is benefit out of that process. And we still have another ongoing trial which is recruiting in the Sydney area, so we're always looking for more people to put their hand up and be involved in that sort of research.
Brilliant, and I think we'll look forward to seeing those results and publication. And you're right, isn't it? It's shifting that conversation earlier, but also ensuring that we frame it in terms of what's important to the individual.
Yeah.
And it's not to shy away. There's no doubt this is a hard conversation. It's how you can marry the science and art of communication, I would think, So something that's come to the fore a lot more is the concept then of supported decision making. Moving away from the traditional substitute decision making, and this is the representative, and ensuring that people are engaged in that conversation for the best time possible. Do you want to give me an idea of what that looks like, and what should we be thinking about with supported decision making, please?
Sure. Yeah. So supported decision making is, I think, a set of concepts and principles that have emerged originally out of the disability rights movement, and it's started to spread into a range of contexts. And I think in Australia it's going to become quite prominent in the aged care setting because we've had the new Aged Care Act pass through Parliament, and that has actually set up a framework for supported decision making across the aged care sector now. So it's certainly going to become a topic of interest. I think practically what it means is any type of help and assistance that can be provided for a person with a decision-making disability or communication needs to be able to have equal access and participation in decisions, particularly decisions about their life. So if we think about examples from across society in our everyday experience, there are accommodations put in place for people with mobility needs. So our wheelchair ramps, our elevators, these sort of things where the built environment is modified to make it more accessible to more people so that more people can be participating in society. And we can apply those sort of ideas when we think about the architecture of a decision or the sorts of ways, the contexts in which decisions are initiated and the sort of accommodations that can be provided for people so that they can participate even if they may have a diverse way of communicating, or the way that for example, their cognitive understanding of a decision might be different as well. And so understanding their needs in that communication process and then trying to fit the context around their needs.
And that's so important, isn't it? Because it's essentially equipping the individual and those supporting them to be able to give them the best opportunity possible to have that conversation and communicate, whichever way that looks.
Yep.
Like, you know.
Yep.
It is a different way of thinking, but I think an important and refreshing look at how this develops. So I think for me, Craig, the one question I then have for you, and coming towards the end of our conversation, is as a health professional, with some practical tips. What's my role, and what should I be thinking about when I'm engaging and providing that care for the individual and their family, because I feel strongly that advanced care planning should be built into every aspect of our healthcare provision and should be part of my makeup in terms of having that conversation. Some practical tips and thoughts, please.
Okay, sure. So I think in terms of that idea of making advanced care planning a more holistic and ongoing process, there's a lot we can do in terms of how we start a new relationship with a person or start a conversation about advanced care planning that leaves it open for the future and something that will then be understood as an ongoing process. Some examples of phrases or ways of initiating that would be things like the patient dignity question, which is, what do I need to know about you to provide the best possible care? And that immediately puts the person who's answering that question in the driver's seat, if you like. They don't need to understand their medical condition in exquisite detail. They can talk about themselves as a person, and then the health professional can be responsive to that. The other thing that I think we can also look at doing there is how do we build off that? So understanding, as a health professional, where do you intersect with a person on their journey? If you're in a community setting and you may have the chance to visit them repeatedly, that's a certain sort of context. If you're in an acute hospital setting, it's a very different context. Yeah. And how can we work across teams so that conversation is coordinated, and that we're passing information along to people who need to know. I think in terms of the supported decision-making space, there's an awful lot we can start to do. The Aged Care Act is really going to trigger that for a big part of our aged care sector. They'll be making changes in their processes. We can be looking at making available the documentation in easy English at least, and other accessible forms of communication. And I think people who are directly involved in advanced care planning could start thinking about this in two ways, at least two ways. One of them is applying the ideas of supported decision making into their advanced care planning practice, so making the process as accessible as possible. But the second one is thinking about the advanced care planning not just to prepare for a future situation where substitute decision making might be in play, but instead preparing people for a process in which over time they may need more support in their decision making. Right. Yes. So people do tend to require a bit of time to come around to the idea of actually accepting help and assistance in especially very intimate parts of their experience and talking about their needs. And so I think if we can encourage people that this is okay and this is important, because it can help keep them involved in decisions about their life, that would be a really helpful practical thing that we can be doing as well.
And a lot to take away from that, but I think really critical points. And thank you. I think that's been very helpful for me. We are at the end of the conversation. Craig, as usual, it's been an absolute pleasure talking with you. I think there's a lot of food for thought that's been shared today, a lot to think about, and I think we should look at this as an opportunity to reframe the future. I think we can all do our bit to collectively contribute to changing the landscape for advanced care planning and ensuring that people really are engaged and truly a part of that conversation. Craig, again, it's been lovely. Thank you very much.
Thanks, Greg. Thanks for the opportunity to be involved, and I agree it's an exciting time.
Yeah, especially that paradigm shift that's happening. Great, thank you.
Thank you.
Well, Craig, I think it's time for us to hear from our audience. I'm going to open up the webinar for live questions. And thank you everyone for listening and attending this webinar. I'll just remind you to be able to ask a question. Please click on the three dots in the right-hand corner of your screen and go to ask a question. I'd encourage you to provide your name and email address as well with the question and comment. Also, if you experience any technical difficulties, please try first to refresh your browser. Otherwise, go to the info link and the live chat section. Right. Oh, we've got our first question, Craig. This one's interesting, and I'm going to put this one to you. The questions come through, and the person's asked, what's the best time to introduce advanced care planning with my patients? Craig, over to you.
Thanks, Greg. Yeah, so it is a question that does come up quite a lot, and there is a lot of talk that we hear about people wondering, when is the right time to initiate this discussion about advanced care planning? And for myself, I think I'm in a pretty clear camp, having talked to you a little bit earlier about the early project. I, have had a lot of experiences working in the setting that I'm in, which is mainly in the community aged care setting, where we see missed opportunities and people feeling that, well, it seems too early, but then all of a sudden it's too late to talk about advanced care planning for some reason. Some crisis has occurred, and people are now in a position where they are sadly unable to express their preferences. And so for that reason, I typically do say that earlier is better. However, there are some complexities that we do need to keep in mind around that. And for some people, if they do have significant uncertainty around their prognosis or other aspects of their situation, that can be a complicating factor. And for clinicians, sometimes they're also thinking about their own skill set or the setting in which they're seeing a particular patient or the relationship they have at that point in time with that patient. And there might be particular times where they do actually want to delay having a discussion until some other matter is resolved. And so I think when I'm trying to manage those sort of uncertainties for myself and talking about, promoting an earlier advanced care planning, I think the main message here is that it's important that we're not taking a formulaic approach. So if people are attempting to think about having, one set of questions that I would ask any patient in any situation, that's bound to be not suited to the particular situation that a person may be in. And so avoiding that formulaic approach and tailoring the conversation to people wherever they are on their own journey. For myself, I have a personal example around this, and I've been working in the area of advanced care planning for a good while. Around 10 years ago, I felt actually it's a bit hypocritical of myself to be out there, promoting the ideas around advanced care planning and not having been through the process myself. So, of course, when I, as a person in my mid-30s, took an advanced care planning document to my doctor and started that conversation, I did encounter a few raised eyebrows, but I think there was an ability there to have a particular conversation that was relevant to my situation, where I'm fortunate to not be living with a chronic condition or a life-limiting condition at this point in time. And so I had a particular set of scenarios that I was discussing around my future planning. And while I'm still satisfied with that now, I know that in the future, I will probably have to revisit that advanced care directive that I have written and make sure that as my condition or my situation changes, that I'm reviewing that and making sure my preferences are being expressed. So I think the message there is that, yes, I do believe that we do need to start these conversations earlier, but we do need to be taking a tailored approach to each person's situation.
Thank you, Craig. And I think very, very wise approach and really an important aspect that we need to keep in mind. It's finding that right time and really being aware of the context that you are approaching this in. So that's great. Thank you very much. I'll move on to now the next question. Okay, how do we build our knowledge, skills, and confidence in our approach to advanced care planning? I'm happy to take this one. Really important question. And look, I think the important thing to recognize and know is what's available to you at a local level. There is a wealth of resources, both at the state and territory level. But I'd also encourage you to go onto our website, Advanced Care Planning Australia, and that will be able to link you to a range of resources, webinars, events that's being held, and also education that's available. Just as an exciting added, we've just recently launched our micro-learning modules, campaigns that's being run that will give you the opportunity to learn at your pace, and they're really worthwhile doing. I've tried them as well, and you know, it's a fun way to learn. The other thing I wanted to let people know as well is, importantly, we partnering with the International Society for Advanced Care Planning, and Advanced Care Planning Australia will be hosting the Advanced Care Planning International 9th Conference in Gold Coast in Queensland in September the 24th to 26th. And it's a real opportunity to learn, to foster networking, hear from experts, and also get involved and engage. The idea is that you know, this would be a unique conference that gives you the opportunity to gain more insight into what's happening not only in the Australia setting but also internationally. So I'd encourage you, submit abstracts. The abstract portal's still open, and please register to be part of something exciting. The other thing also is, if you do find the opportunity and you want to look beyond the Australian setting globally, I'd encourage you to go on to the Advanced Care Planning Society International's webpage, and they have membership and a whole range of resources and articles available as well. We'll provide these links in a post-webinar for you as well. Any other questions that we have? Oh, yes. Okay, so someone's come through and said, so who do we involve in the advanced care planning conversation? Craig, if you don't mind, I'm happy to take this one as well. Look here, it is important to understand the context again, and I think certainly, you know, we should all be engaging as health professionals and healthcare workers and aged care workers in at least starting the conversation. But importantly, going back to our previous questions, you know, understand the context, skill and build that knowledge and confidence to be able to do this, and then have a go at having that conversation. It has to be on the person that's going through the advanced care planning process on their terms. But other people to involve would be the substitute decision maker. If they give permission, I think there can be care support people, other family members, and it may be looking at beyond that immediate family and support structure. You know, it may be that the person wants their neighbor or a very close friend or someone they trust to be involved, or someone that matters to them to be involved in those conversations. And I think importantly to recognize this is voluntary and is a process. You don't have to cover everything in one setting and in one go. Okay, I think we're now at time. Just again, this has really been an important and rich conversation with so much, you know, to take home and to digest. I would encourage you, you know, to keep looking and following us on our LinkedIn site. Go to our webpage. And also, just for your reference, this webinar will be uploaded and available on our YouTube channel. We also have an e-news subscription that, it would be great if you can subscribe to and follow us. And again, importantly, keep an eye out for the international conference and anything coming through around advanced care planning. But important to have that conversation. So I'm going to wind down now and just say again, Craig, thank you very much for your time, and to our audience, thank you for joining us, and really appreciate you taking time to answer questions or to ask questions and be engaged and involved in this. Bye for now.